cancel. My sore throat.
Seatbelts, everyone. Ralphie, say ah.
Cool. I've never seen that from the outside before.
There are two types of radiation, ionizing or non-ionizing. Non-ionizing is generally less dangerous to humans than ionizing because it can't penetrate deep into tissues, but it can affect the skin or eyes. Non-ionizing radiation comes in the form of light, radio waves, microwaves, and radar. Ultraviolet light, a form of non-ionizing radiation, can produce skin cancer or cataracts if someone is exposed to too much of it. Ionizing radiation, however, can be extremely dangerous if not fatal towards humans if they are exposed to too much of it. Ionizing radiation comes in the forms of X-rays, gamma rays, and particle bombardment. Although dangerous, ionizing radiation also has various medical, industrial, and manufacturing applications. Ionizing radiation can cause radiation sickness. Acute occurs when a single larger dose of ionizing radiation is exposed to someone, and chronic occurs when many smaller doses of ionizing radiation is exposed to someone over time. Exposure to X-rays or gamma rays is measured in Röntgens and Gray. 100 Röntgen units is 1 Gray unit. 100 rads causes radiation sickness. 400 rads causes radiation sickness and death in half of people exposed, and without treatment causes death within 30 days. 100,000 rads causes nearly immediate unconsciousness and death in around an hour.
Out. Here we go.
The effects of ionizing radiation on any system is dosage and case dependent. If a patient has been exposed to around 1.5 Gray of ionizing radiation, they usually develop nausea, vomiting, and gastric atony. In more severe doses ranging from 5 Gray to 12 Gray, they lose crypt cells and their mucous barriers are destroyed, which causes abdominal pain, nausea, vomiting, diarrhea, and gastrointestinal bleeding. Those symptoms can combine with complications with the immune system and accelerate the fatal stages of radiation sickness. In patients with upper abdominal radiation, around 50% of them experience nausea, vomiting, dyspepsia, and abdominal pain. Chronic symptoms include ulceration and rarely gastric wall fibrosis and gastric outlet obstruction. Patients with intestinal radiation usually experience nausea, diarrhea, and abdominal pain, as well in severe cases, fistulas or intestinal obstructions develop.
Heading up his nasopharyngeal passages.
The what? According to my research, that means his nose?
We're up Ralphie's nose.
The effects of ionizing radiation on the respiratory system is mostly harmful to the lungs. Pictured here is the fibrotic tissue created by radiation damage to the lung. The death of endothelial cells causes capillary leakage into and onto the alveolar surface, which can make gas exchange harder. The two major symptoms of radiation exposure to the lungs are radiation pneumonitis and radiation fibrosis. Radiation pneumonitis, which is a kind of inflammation to the lung, develops in exposure to the lung greater than or equal to 8 Gray units of X-rays or gamma rays. Radiation pneumonitis can be separated into 4 phases: a latent phase, an exudative phase, an acute pneumonitis phase, the late or chronic phase. In these phases, the lungs slowly start to exhibit the inflammatory nature of radiation pneumonitis, and the cells in the lungs and capillaries start deteriorating or become adversely affected. The circulatory system can be one of, if not the most damaged system by ionizing radiation if affected. At high radiation doses, there are many symptoms which more notably includes damage to the heart, the coronary, carotid, and other large arteries. Due to the damage that can occur to the veins, arteries, and heart, the blockages and such can impair or negatively affect the function of body organs and tissue. As said before, high radiation doses can make fibrotic, scar tissue be produced in tissues and organs, and impair the organs. Some other effects are the adverse effect on the immune system by the way of less lymphocytes. The bone marrow may also be adversely affected. Capillaries can be destroyed by ionizing radiation exposure. Although the radiation can damage the heart, in most cases, the heart is a slow responding organ that can only show effects many years later in the form of heart diseases. There have been many well-known radiation incidents like the Hiroshima, Nagasaki, and Chernobyl disasters, with between 9,000 to 166,000 fatalities, 60,000 to 80,000 fatalities, and around 4,000 fatalities respectively. However, I'm going to be talking about an incident that is pretty well documented biologically and otherwise, but is lesser known. This incident occurred on the 30th of December 1958. On this day, a man named Cecil Kelly was working at his job at the Los Alamos plutonium processing facility. His job was to manage the mixing machines that process plutonium. However, on that day, there was an erroneous amount of plutonium concentration in the machine he was assigned to. As a result, when he turned it on, he was bombarded with around 3,600 rads in total, which is severely fatal. He was rushed to the Los Alamos Medical Center, and his situation was quite frightful. He was semi-conscious, he was retching, vomiting, and hyperventilating. His skin was cold and reddish-violet, and his lips had a bluish color which indicated poorly oxygenated blood. His pulse and blood pressure were first unobtainable. He had shaking chills and had to be restrained by staff. After around an hour and 40 minutes after exposure, Kelly regained coherence and complained of severe abdominal pain and occasionally rushed and vomited. Kelly's blood samples were drawn, and because he had been irradiated with neutrons, sodium and other light metals were transformed into radioactive isotopes. 6 hours after exposure, his lymphocytes virtually disappeared from his blood flow, which was taken as a really bad sign. 24 hours after exposure, a sample of his sternal bone marrow was taken, and the marrow appeared watery and was almost completely acellular, fluidic, hemorrhagic, fatty tissue. It was decided that he would not last long. Around 35 hours post-exposure, Cecil Kelly had passed away. Post-mortem, an autopsy was performed on his body. It was found that 50% of the plutonium he had been exposed to was in the liver, 36% in the skeleton, 10% in the lungs, and 3% in the respiratory and lymph nodes. His death was an ultimately grim consequence of a miscalculation in his workplace.